Good morning, all. I'll be presenting. I have no conflict of interest and no financial interest in my presentation. As we all know, retinoscopy is an objective refraction technique, which is very skill dependent, and the worst part is it is very difficult for the initial residents to actually get this skill and to understand what the mentor is actually telling. And there are no live demonstrative instruments until now to record or to even show the residents how the reflexes look or to teach them, and it becomes very difficult, and it becomes a very large learning curve we'll require to make them understand. So over here, so we use a schematic or model eyes to actually demonstrate, and there are no video libraries showing actual live demonstration of the reflexes. And this becomes a very big problem because it increases the learning curve. So over here, like you see, when we say with the movement reflex or we say against the movement reflex, it's little difficult for them to understand, and it takes some time for them to understand. So over here, what we did is we thought, why not use a smartphone, and why not use a smartphone in a way that a gimbal works. So a gimbal is a small instrument which helps the phone to be stabilized. So we combined these two things, the smartphone and the gimbal scope concept together, and then we made the gimbal retinoscope, that is the gimbal scope. So this is the actual thing. These are my co-authors, and I'm Dr. Prithvi. So I will. So over here you can see you use super glue, few adapters, and the retinoscope to attach. This is the way we have made it. So we attach the two adapters together, and the adapters then with the smartphone attached to the retinoscope. And once that is done, we attach the phone to it, and we take the reflexes. We can record the images. We can even take live demonstration and show it to them at the site itself. You can see how against the movement is well demonstrated here. This is the neutralization point, and this is a scissor reflex. So all these are very simple. It's a very frugal and very easy to do thing. So this will so over here we had some limitations in this procedure. So it was actually a little difficult for few people in the initial learning curve to assemble it. It was heavy, and the focusing sleeve was a little difficult to approach. So we thought about 3D printing it. So now what happened is we have 3D printed a small adapter which is so small, and it can be connected to a endo camera. So this was available in the Amazon for 1,000 rupees. So 1,000 plus this small thing actually costs just 100 rupees if you want to 3D print it. So you just fix it to the retinoscope, and you're good to go, and it gives exactly the same quality of the smartphone. And you can even see these images in the smartphone. You can even connect it to the laptop, and hence it is very simple to make resident, and even you can make your own library of all these reflexes. Thank you.
Attach the camera
The smartphone.
on one side.
Yeah, I have a.
Please show.
So this is the camera which we are using. Yeah, this comes in Amazon. This comes in Amazon. This small this endo camera, which comes for around 1,000 rupees. You can just put this in. This is actually a 3D model, and then you can just fix it over here. This one is the retinoscope, and you can just fix it over here, and you can connect this either to your smartphone. Yes, yeah, it fits. Yeah, and this same size. This is a high. This is the most commonly used retinoscope. That's a high beta 2000. So this is what almost everybody has, except for some few people use Keeler. So we can design for that also. For now we have this one because this is what we use in our hospital, and so this is fixed. This you can connect it to your computer, or you can connect it to your phone itself. So you have a small adapter which you can connect to the smartphone also. So you just have to download an app and it will show up in your phone. Yes, this is for the phone, this is for the computer, USB device, and this is the actual initial prototype. So this one directly goes to the smartphone. You just have to open this, connect it to the retinoscope, the handle over there. Yeah, yeah, this is also very easy. This is the prototype. Yeah, this was the first prototype, and this was the modification. Easier. Yeah.
Arvind Maurya.